sacs, each of those air sacs is well invested with a capillary network. The capillary beds are fused to the alveoli so that there's a very short distance for the gases to move. So as a result of that, when you inhale, you load up the alveoli with oxygen, it diffuses across the wall of the alveoli into the capillaries. And of course, as the red cells are loaded up, they move back to the lungs, where they'll be distributed throughout the body by way of the systemic circuit. These walls in the alveoli, when they break down, that's a condition known as emphysema. And as a result of that, you're losing surface area with the exchange of gases. So they have difficulty loading up their red cells with oxygen, but they can move air in and out relatively easy, which is known as compliance, because it's kind of an open area. It makes it easier to move air in and out. Here, you can see the visceral layer. And now here, you can see the parietal layer. And then between them is the pleural cavity. So you have the visceral layer, parietal layer, and the pleural cavity. In the cavity, there's a vacuum in there, negative pressure, and because the visceral layer is not fused to the parietal layer, when the chest cavity expands, the vacuum pulls the visceral layer with it, stretching the lungs. And as a result of that, when the size of the chest cavity becomes larger, the pressure inside the chest cavity drops below air pressure, room pressure, and you inhale. Now, because of the natural elasticity of the lungs, they're going to recoil. And when they do that, the pressure inside them is going to get higher than atmospheric pressure, and you'll exhale. So during this type of breathing that you're doing right now, which is called normal quiet breathing, you're moving about 500 milliliters of air in and out. About 350 gets to the alveoli, which are the exchange membranes, and the rest, 150, remains in the primary, secondary, tertiary, trachea, larynx, oral, and nasal cavity, which is called the anatomical dead space. And it's just a conduit to bring air in to the respiratory membranes, which are inside the alveoli.